Hey guys, it's Georgie here, owner of Distinctive Features. I am making you this video to explain everything that you need to do to prepare for your tattoo appointment. Whether or not that tattoo appointment is brows, eyeliner, lips or areola, there is preparation that needs to be done and needs to be read. But a lot of people don't read the information. So I thought if I make a video about it, you can listen to me talk. If you don't want to listen to me talk, you can hop on our website and click on download and download the important information sheet. It says important information for a reason because it's really important and you need to read it before your appointment and weeks before your appointment, not the morning of your appointment. So I'm going to go through everything that's in this information so that you don't have to read it if you don't want to. So first and foremost, by law, you have to purchase your own anesthetic secondary gel. We're not technically allowed to supply secondary gel to anybody unless it has their prescription on it, and you can't get somebody else's prescription. So this has been a problem for quite a while in our industry, and we're trying to stick to the standards and do what's right, but a lot of people aren't reading that information. So on the information sheet, in the very, very first paragraph, and this information sheet is sent to you in a link in your reminder email, and you need to click on that link and it comes up with this information. The first paragraph in the information tells you which numbing gel you need to purchase and that you need to purchase it a few days before your appointment so that it's ready. We have organised with the Compound Chemist, which is literally 6 minutes down the road, that you can go and pick it up and then come to your appointment with your with your numbing gel. And that gel is there to make you comfortable. It's different to body art, where body art say don't use numbing gel at all. This gel you bring with you, and we use it on open skin for a very small amount of time to keep you comfortable, because especially when we're doing brow tattooing or any tattoo on the face really, if you're not comfortable, you'll contract your muscles and move your face, which makes it very hard for us to get a very smooth job. And also it's quite painful if you're not numb. So yes, you might be covered in tattoos or you might not be. You might think you've got a high pain threshold or whatever, but we need you to get this numbing gel. Do not put it on yourself. I want you to buy it and bring it with you to the appointment. The information of the Compounding Chemist is on the information on the website. If you're not sure, you can always send us another email or a text message and we can send you the phone number as well. We do have a few different tattoo methods. We do eyebrows, eyeliner, lips and areola. And for eyebrows, predominantly we use a machine, but we do also have a microblade technique as well. But all techniques that we do for eyebrows, eyeliner, lips, it's all determined by the type of skin you have and the age you are. So don't think that just because you see something on one person that it's going to be the same for you. And that could even be the same case for siblings. If your sister came to get one treatment and then you'll come to get the same treatment, you both might get something very different because your skin type might be different, your ages can be different, your level of sun damage can be different, and so many other things that can contribute to what technique we actually decide to do on any one person. Your growth, your hair growth patterns, and how much hair you actually have on your brow area will actually determine how much or what technique we can actually do on you as well. If you've got bald patches, if you've got thick wiry hair, if you've got no hair, it will all play a part in what technique we will actually decide to do on you on the day. So you may decide to book online for feathering, but when you come in, we may take one look at you and go, you're absolutely not suited for feathering, and vice versa. We might say you might book in for an ombre, but you might have old tattoo or something, and so we might have to change the way we do things. So everything's always a guide when you're making your booking, but please be open to possibly being changed to what you may not be expecting, because it's all according to what's already in your skin and your skin type and your age and the size of your brows and so on and so forth. There's a lot going on. What else have we got to talk about? So what we also need to know before you come in, or at least you need to take note of, is what kind of medications you might be on. A lot of medications will have a detrimental effect to how brow tattoo, eyeliner tattoo, lip tattoo heals. So please, If you are on any sort of medication and you're not 100% sure, please send us a message, send us an email with that medication that you're on so that we can double check that for you and see whether or not you're contraindicated. Because we've had all too many times people coming to their appointments with a list of medications because they haven't read the information, only to find out that they're completely contraindicated, and we've had to send them away and say, unfortunately, we can't tattoo you. So if you can please check your medications and send us an email if you're not sure. The main things that we do want to be sure of is that those medications are not photosensitizing, they're not immune suppressing, and they're not skin thinning. These are the three main factors that actually will contribute to whether or not we can tattoo you. If it's any of those three, you're a no-go until you're off those drugs. So we will look into that for you if you're not sure. So we do have a booking fee deposit, and that deposit is there to cover us if you cancel last minute. I still, as a boss, have to pay my staff all wages. We still have all of the overheads. And if somebody's just not going to show up or they're going to forget about their appointment, then my overheads don't stop either. And that basically renders us with a gap in our day where we're not actually bringing in income. Yes, this is a business, and a business is there to bring in income to pay the bills and to pay the staff so that they can all pay their own mortgages and so that they can all do everything as well. So if you cancel last minute, and last minute can be anywhere up to 48 hours, less than 48 hours notice, then you risk losing your deposit. So please keep an eye on that. If you decide not to come to your appointment, if you've changed your mind, we are absolutely happy to give you a refund if you give us enough time and notice to cancel your appointment, because that gives us time to actually move somebody. But if you don't rock up, or you call us and say you're going to be you can't make it that day, then that's almost impossible for us to fill that appointment in. Rocking up late to your appointment as well. We have about a 10-minute, 15-minute leeway, but if you're longer than 15 minutes late to your appointment, then you will be rescheduled and you will lose your deposit. So please make sure that you leave ample amount of time to be able to rock up to your appointment, even 10 minutes early, so that you're not going to be late for your appointment, so that we don't have to turn you away. We also need you to rock up early for your appointment because we need you to fill out some forms, and sometimes the forms can take people longer than others. We have tried to go paperless, so they are all on iPads now, and for some people, iPads are really hard to use. So if you can come a little bit earlier for your appointment, especially if it's a new appointment, so that you've got some forms to fill out. If you're coming for a maintenance appointment, you can still rock up a little bit earlier, but don't forget to make sure that you let us know if you're on any new medications that maybe you weren't on last time. Yes, so coming early to your appointment is a good idea, just 5-10 minutes early. Please understand that you also cannot bring somebody to your appointment. The only time we will allow someone in the room is if the other person does not speak any English at all and they need an interpreter. We have had also other people who might be vision impaired who need a carer of some sort. That is sort of extenuating circumstances, but for everybody else, a support person or somebody who's just coming to watch, we don't allow that. We don't allow people in the room because it can be very, very distracting for the artist. They're trying to do their best work, working on somebody's face, and also having other people sort of try and put their input in to what somebody's shape might look like and things like that when they're not a brow tattooist themselves. It's very, very distracting and off-putting for the tattooist, and you want them to look to be as relaxed as possible when they're working on your face. It is also illegal for you to have somebody under 18 in the room, so please do not bring your children to your appointment. I'm a single mum myself. I fully understand what it is to have children and have to come to an appointment, but young children, we just can't have them unattended in the front room. If you bring somebody to attend to your children whilst you're in your appointment in a separate room, that is fine, but their children are not allowed in the room, and you have to understand that my staff are here looking after our clients and answering the phone. So if you have a 2-year-old sitting in the foyer, my staff are not babysitters, and as much as we love children and we are happy on occasion to help for 5 minutes, we can't be there watching your children for an hour appointment whilst you go and get a tattoo. So if you cannot get your children looked after, you will need to reschedule your appointment. It is a safety procedure. You know, this is an infection control situation. We have needles in the place. We're working in open skin on people's faces. We can't have the distraction of children in the front room, or, you know, the mother who's laying on the bed and worried about what their children are doing in another room. So please understand, we love children. I'm a mum too, but we just can't have children here whilst you're getting a tattoo. What to expect? Okay, so when we are doing your eyebrows, we're going to map your eyebrows, and when we map your eyebrows, we map them to your facial structure. We will map your eyebrows to a certain thickness, but then we will also take into account your age, because your age will actually determine quite a lot of how your brows need to look. A younger person who wears a lot of makeup is going to want brows that are a lot more intense, but a more mature age client is going to want something softer, is going to want something, you know, a little bit more, sometimes even thinner. We work very cautiously with your brows, and we can also add to it later. We can do things over 2 to 3 sessions. With eyebrows, we might build up the color over a couple of sessions. Eyeliner, we might start off very, very natural, but at the next session, you might go, no, I want 3 times the amount, or something like that. Again, we need to look at your skin health and your skin laxity as well. Whether or not you have firm skin or wrinkly, crepey skin will actually determine, again, what we're doing. Once we've actually pre-drawn in what we're going to show you in the mirror, and it's going to look a lot more fierce in the mirror than what the actual tattoo is. So that's all very normal. When you finish your tattoo, it's always going to look brighter, darker, and much redder, apart from eyeliner. So your eyebrows and your lips, they're going to look very bright, very intense, very dark. And the next day, they're going to look even darker because they're going to oxidize. So once they've done their oxidation, they're going to start to heal. And as they start to heal, they start to peel. And the peeling happens sort of around day 4, day 5, day 6, depending on what treatment you're getting done and how fast your natural skin renewal process is. When the peeling happens, it looks scary. It looks like something is going wrong. It looks like it's not meant to be happening, because your brows will be peeling off in chunks, your lips will be peeling off and flaking off, and it looks like there's nothing left in the skin. But once that is all fixed and once it's all healed, you'll see the colour start to blossom about a week later. So it's very normal for scabbing to happen. It's very normal for it to lighten. You know, your body's immune system is there to fight foreign body, and pigment that we're putting in your skin is foreign body. So that's something to take into consideration. We do need you to clean your brows. So you'll need to be wiping your lips or wiping your brows, whichever treatment you've done, continuously for the first 24 hours to get any fluid off. And this will actually help minimize the scabbing as well. For eyeliner, we just get you to dab it a little bit the night after that treatment, and we get you to put eye drops in. And you can put cold compresses on everything, because cold compresses, where they're sort of damp cotton pads, you leave them in the fridge so that they're nice and cold. You can hold them over the areas. That will help to take down any inflammation and any stinging that might be happening. Remembering that it's a tattoo. A tattoo is an open wound. It's going to be stingy for a couple of days. It's going to be a little bit tender. It's normal. The only thing that's not normal is infection, and infection will present itself as severe swelling, severe weeping, even pus, and redness. And the very, very, very off chance that this happens, and I think I've seen it happen maybe 5 times in 20 years, you just go to the doctors, they'll give you antibiotics and a steroid cream, and it'll fix it pretty quickly. Being able to stop infection is by keeping them clean, not touching them with your fingers, not picking them, not getting makeup on them, avoid sweating, and avoid sleeping on your face. Don't let the pillow touch your face whilst you're sleeping. And don't run them under water as well. So if you run them under water, what can also happen in the shower is that the scab will get a little bit soggy. That can get knocked off too soon once it's soggy from being wet, and that will restart the immune response months, and then your body will reject all of the color. If it doesn't get knocked off too soon after the scab's been wettened down, it will dry, and it'll dry even harder and thicker, like a really thick, hard, crusty scab. And that will also act like a sponge and pull the color out. So not immersing them in water in that first week whilst the scab is doing its thing is really, really important. But wiping with a damp cotton pad, wipe. It's a little bit uncomfortable, but it is definitely something that you need to do for the first 24 hours of your appointment. And then if you've got scabbing on your eyeliner, just be really, really careful that if the scab is attached to your eyelashes, but you can see it's detached from the skin, you need to wet that down so that you don't yank your eyelashes out. You need to wet it down and slide it off your eyelashes. Sometimes the scab can be caught because of how close we are to the roots of the lashes, and also because we're putting the silicone gel on your eyeliner, which can dry into your eyelashes. So just wetting that down and sliding it off your eyelashes. For your lips, you can put your aftercare on as often as you like, and just bearing in mind that if you do have lip tattoo, if you have even had one cold sore in your life, around day 4 of healing of the lip tattoo, you may get a breakout in cold sores, and it can actually be a very bad breakout. So we do advise you to take the drug Famvia, which you can get over the counter at the chemist. It's 3 tablets, and you take all 3 at once. You can, if you get severe cold sores, and severe, by severe I mean 1 cold sore a year. Okay, 1 cold sore a year is severe enough for you to get a very, very bad breakout from lip tattooing. And so you can get a prescription drug from the doctor called Valtrex. Some doctors will give it, some doctors won't, but often when it's just an one-off treatment, like lip tattoo, you should be able to get it from the doctors. For eyebrows, for lips as well, you can put your aftercare gel on as often as you like. Now for eyebrows, you're only going to put your aftercare gel on morning and night for 5 days, and it's just a very, very thin film of aftercare. We don't want you to be wet with aftercare. We don't want you to constantly put heaps and heaps of aftercare on, because we don't want your brows to be wet. So we're just putting a very, very small amount of aftercare gel on. It's creating a barrier, a bacterial static barrier, because we give you a silicone aftercare. And you're only putting that on for 5 days, and then that's it, you stop. The aftercare gel we give you on your initial appointment is enough for your first and your second session. If you do lose your aftercare gel, you'll be required to purchase another one from the front desk as well. So don't lose it, and don't use too much, because there's plenty in that tube for your first and second session as well. And then of course, once we've done that, we do your touch-up, and your touch-up is normally around the 6-week mark, sometimes even 8 weeks. We can even push it out to 12 weeks if you're going on holidays or something, but we never rush your touch-up, and we never do it too soon, because there's still an immune response going on in your skin. And if that immune response is still going on, then the colour's not going to hold, and in some cases can even reject what we previously put in. So at the touch-up, we can adjust colour, we can adjust shape, we can adjust thickness, because like I said, we always work very cautiously the first time. So there's always going to be enough room to add more colour, to add more depth, to add more warmth or coolness, just really according to how much your body metabolizes that colour. So in a lot of cases, we go for it a lot more at the second session, because we've learnt your skin better. We understand what your skin's going to do better. But if we do that much product and that much, if we put too much in on your first session and then you hold it on, then sometimes they can be oversaturated, and then that's a problem. We have to try and get it out. So a lot can be done at the second session, and we get the comment of, oh wow, I didn't realize how much they've faded, or oh wow, you did a lot more at the second session. And I'm very happy to do that, because I've learnt your skin more. So please understand that we do things the way we do things on your first session on purpose, so that we can learn your skin, and so that we can be cautious, and also so you can get used to your new face and your new eyebrows. And then we can add more to it and play around with it at the next session confidently as well. How long it lasts is different for everybody, so we never guarantee a lifespan. But as a guide, it's normally between 12 to 24 months that you'll need a maintenance. And when I say maintenance, your brows are not disappeared. cosmetic tattooing we call it cosmetic for a reason. They change over time, but they never disappear. If somebody tells you it's semi-permanent, it doesn't mean it's going to disappear. It means it's going to change and fade over time. So technically, it's permanent in a way that it never disappears, but it's semi-permanent in a way that it changes and never stays the same from the day you had it done. So we call it cosmetic tattooing. So most people need maintenance around 12 to 24 months, anywhere around then. Some people can even go 3 or 4 years, depending on the pigment that's in and how saturated we put in and how dry their skin is. The drier the skin, the stronger something's going to hold. The oilier the skin, the softer it's going to fade over time. So maintenance, when we do our maintenances, the maintenances are going to be according to the time span or when you're ready for your appointment. Pardon me. And at your maintenance, in some cases, you've still got very dark brows, but they've just changed color. They've gone either a little bit too warm or a little bit too cool. So if they've gone a little bit too warm or a little bit too cool, then but the depth is still there, then that's when you're ready for a maintenance, so that we can adjust the color with a filter layer or a filter tattoo. So if we do a filter tattoo, what that basically means is we're still doing an appointment. We're still tattooing you, but sometimes we'll tattoo you in a completely different color to what we initially did because the color's changed. So often we might go over with an orange or an ashy sort of a color, depending on what color is actually there. Whether or not you need a shape change or something like that is determined again by the mapping. I've been tattooing people for, 15, 20 years, some of my clients. And, obviously in that amount of time, someone ages. So their brows will get lower and lower as they age. And as they get lower, then when we remap, you'll find that sometimes we have to lift them a little bit more, which means that sometimes there might be a little bit of a shadow underneath those brows. And if that's the case, then that's when we sometimes offer a little bit of removal, just to try and lift the brows and make them look a little bit better. The other reasons why we might do some removal is, one, because you've had microblading for many, many years and it's become oversaturated. You've been to many different artists and you've had lots of different brow tattoos done that have also become oversaturated. The skin is like a cup of water, and when you fill up a cup of water, it overfills when it can't hold anymore, and the skin will actually do the same. So when the skin can no longer hold any more pigment in it, the result of the tattoo is actually slim to none. There's nothing much happens to it because there's so much pigment in there that no more pigment holds. So if you get to that point, then we're going to say we need to laser it out and start again. For those that have had microblading for many, many years, we'll often say we need to remove some of that because there's just too many layers and too much tattoo in there for us to actually get it to look nice and smooth again. So there's lots of things that we do with the brows, and I will make some other videos about it. But hopefully this has given you a little bit of insight into your appointment, whether it's with brows, with eyeliner, with lips. And yeah, I will make some more videos. Anyway, thanks for your time, guys, and I can't wait to see you for your appointment.